wards. Of the 14 million Canadians that visit the ER every year, 3% left without being seen. A third of the patients who require hospitalization wait more than 10 hours to be transferred to an appropriate inpatient bed. As the demand of emergency services continue to rise, the accessibility of emergent care decreases. Overcrowding, the principal cause of prolonged wait times, occurs when the demand for emergency services exceeds the ability of the staff to provide quality care within acceptable timeframes. The budget cuts caused a 40% decrease in hospital bed capacity, creating an impaired flow of patients from the ER to ICUs. It occurs when bed occupancy rates approach 85%. It begins to occur more consistently at rates greater than 90%. Unfortunately, most hospitals in Canada regularly operate at a bed occupancy rate of 95%. Almost 50% of the patients who visited the emergency were discharged within an average of 2 hours from registration, depending on the severity of presenting illnesses, patient's age, patient traffic, and time. Patients waited an average of 51 minutes from the time of admission. Funding cuts to long-term care is greatly associated with the lack of admitting beds in acute care wards, causing congestion in the ER. Shortages of long-term care beds have pushed back many non-acute patients from being transferred to an appropriate nursing facility, affecting the flow of patient transfer from the ER to acute care unit. The inability to transfer patients from the ER to inpatient beds results in boarding of the admitted patients in the ER for long time periods.
How routinely at hospitals, emergency room patients are shunted into corridors and other public spaces, stripping them of privacy and dignity.
The lack of admitting beds, either in an acute or long-term care setting, has definitely impacted the traffic in the ERs. Many non-emergency patients that are waiting to be transferred to the appropriate care units are occupying many beds that are needed for admitting new patients. The resources and funding that are distributed to the acute care units are also being used inefficiently for those who are using the acute ward as a transitional unit. If changes are made in one area of a medical service, there is a likelihood that other areas of the healthcare facilities could also be affected because it is only being used in 80% of all Canadian ERs. The CTAS has proven to be effective. It has reduced wait times significantly in the UK, and almost all their patients spend less than 4 hours in the ER. It is an overwhelming situation that may create negative impacts on the patient's physical, emotional, and mental well-being, the number of patients leaving without being seen, and the risk of poor outcomes.
Care and compassion are being compromised.
ER overcrowding has created a barrier for healthcare providers to deliver quality care in a timely manner, causing patients to experience unnecessary prolonged pain. 27% of emergency room users felt that the care they received was either fair or poor. Patients being assessed and treated in the hallway inhibits the nurse's ability to perform thorough assessments and protect the public by maintaining privacy and confidentiality, as well as to preserving dignity.
Inside, it's busy, it's crazy, but I love it.
Hello.
In order to understand why these professionals thrive in this environment,
How are you feeling now? Better, worse, same?
Issues that come up in the ER every day, heart and breathing problems, gastrointestinal bleeding, but each person...
I try to avoid it. But the bottom line is I'm walking to the back so I can pull the chart and tell you what the story is.
Dr. Mitch Schulman, who's been racing up and down these hallways
today, in fact, island-wide, ERs are 142% over capacity. The worst situation at St. Mary's Hospital at 187% over capacity. Verdun Hospital is 181% over, followed by Lakeshore at 177%, and the Jewish General at 164% over capacity. Cindy Sherwin joins us.
But don't have a definitive reason why. The Jewish says, for example, they speculate that perhaps there are a lot of people who are in beds and they're waiting to be transferred to rehab centers, and that is backing up the ER. But Le Montreal General, that is also at 177%, is saying they are not seeing, for example, a high number in the people coming in with heat exhaustion. It's not because of a certain kind of infection or virus virus that's making the rounds. In fact, they're seeing a lot of broken legs from bike accidents. So they're having a hard time figuring out exactly
results than most other countries. So it's really a trade-off.
Still, the average length of stay in an emergency room is 4 hours. 1 in 10 people have to wait more than 8 hours. Compared to Australia, the UK, and the US, our wait times are much longer. And outside the emergency room, things aren't much quicker. On average, you'll wait 2 days to see a family doctor, 30 days for a specialist. Amazingly, we don't complain much about this. Only 15% of Canadians found wait times to see a doctor unacceptable. 29% are unhappy about waiting 30 days to see a specialist. Will the system